Good morning. I'm Dan Doherty. I'm the chairman of the Stoneham Board of Health. And I'd like to welcome you all here to the Mystic Valley Coalition Region 3 Emergency Operations Center and Training Facility. This morning, basically want to just let everyone know what we've accomplished here with the Regional Coalition, as well as thank a lot of you that have attended. This is something that we put together over the last year based on an idea that's something that is needed and necessary. Hopefully, training is what will happen here, and we don't have an event, but if we do, we're glad that we were able to put this facility together. Right now, I want to turn this over to Chris Webb, who is the Malden Public Health Director.
The goal of the center from this point forward is to expand and learn from what we already know, and then develop standard operating procedures for this center, the management and control of our Medical Reserve Corps, the Citizens Emergency Response Teams, and then integrate our ability to work with other public safety officials and agencies in the use of this room and rooms like it. And hopefully this will expand to other communities, hopefully our neighboring regions, and we'll have a wider, broader base and capability to work from. So I would thank you all for coming. If you have any questions, I'll take them now.
Could you talk a little about the training, who will be trained up here?
We're hoping to open it up to just about anybody who wants it. Obviously the office is open during the day, but our main focus from the public health side will be the Medical Reserve Corps, which right now our region has a little over 100 members. Mostly medical personnel, doctors, lawyers, not doctors, lawyers, I was going to say Indian chiefs, but doctors.
We have doctors and lawyers.
We do have, actually we do have lawyers, that's right.
Dentists.
We have dentists, undertakers, all of the things you're not really want to talk about. The core of what you're going to need when there's really a public health emergency. All of those folks have been going to trainings already that Karen's office has been really pushing, and good response. And they're all at their minimum training standards. They've all been Core 8 checked, so they're safe. They're being trained on incident command, which they're all up to speed on. Now we're going to move, and this year we'll move forward. Our training is going to focus on emergency dispensing sites. And in this region, there's over 20 of them. So we need to gear them up for each community, walk them through these scenarios, the plans. The plans are complete. This was the thing that we needed to be able to exercise those plans.
Maybe you could just help us to maybe understand a little bit better how a center like this might be able to help in easing probably the public's concern, getting information out to the public when something like that happens, or a norovirus, or whether it be coming up on a mosquito season. I'd like to hear something about that.
It works perfectly for that, and we have experience in this region dealing with not norovirus, but meningitis in particular. We fashioned the phone system here to handle just that. We've got 8 phones, obviously, we can plug in more. We've got the capability of taking 80 phone calls at a given time. There'll be voice backup on that. Please hold while we can, if you want to talk to a live operator. And then obviously a message. But we can man this as a phone center and divert, just by putting those calls out. If it were an incident in, say, Malden, we'd staff this office and bring all the phone calls here rather than bog down city halls or town halls in the region. And be able to give out that information. We'd also be able to do our press releases from here rather than having them all over the Babson campus, which is really not what you want. You want the press off, let them take their pictures from afar, but get them in a room like this, brief them, provide them with all the handouts that you're going to need, and get the information out once, get it out right.
Does each town in the city in the Mystic Valley have their own office also, or is this it? I live in Melrose. Is this it?
No, Melrose has a emergency operations center from the fire side, and we can relocate this whole room by packing it up in a mobile trailer that we have. We could pack this up and move to Melrose if we had to. If we had to originate an event there, we could duplicate this room there, as well as in Medford, Wakefield, Malden,
Interesting,
anywhere.
Thank you.
Anywhere.
I was curious.
Yeah.
Chris, why don't you explain how this can hook up to what's happening in the state, like when the December ice storms and things are happening everywhere, and maybe Graham from MEMA can help you with that, with Webb EOC, and how this can connect to that.
Right. Webb EOC is a valuable tool that we're using now in all aspects of emergency management. Everybody used to say public safety, but it really is emergency management. Public health is now a key in that tool system. This room would be instrumental in I think, in a snow event or a flood as well. You could run logistically from here all of those support elements that you need that aren't police, fire, public health as well. So this could be a good standoff room to handle drinking water issues, sanitary sanitary sewer issues, all the sheltering, medical care. You could actually bring your hospital here, have a representative of each of the disciplines here to handle that without having to be in the flood zone, getting wet and dealing with the issues. So it's important. And I don't know if we're looking to Graham Campbell for more guidance on our SOPs when we build these things out as to how and what we use this room for. But if I left anything out?
No, I think correctly said. I think that this provides a great overflow. You know, because in an emergency, our challenge is getting people into the EOC, is getting people to show up, the right people. And then sometimes everyone wants to go, so not everyone can fit inside a room.
That's why we made it small.
It's very smart. Yeah, and I noticed it's not a lot of chairs. The more chairs you have, the more problems. So, but the reality is that you're going to be able to provide, like the ice storm was spoken of, with cots, and whether even if you're not affected, you know, the issue is if you're not affected, but you are providing assets. We're requesting cots, we're requesting MRC volunteers from the Mystic Valley or in this area. You guys can provide a vital service from this very room in helping, you know, areas west of here, south of here, or wherever else. So it's a great step forward, I think, for emergency management and public health.
And because of Webb EOC, we could actually monitor from here without even interrupting the flow of communication in the incident by just watching it on the Webb EOC, which is an internet-based software program, and we can recommend services that we could provide.
So you're connected to each town or city in the Mystic Valley? Webb
And beyond, statewide.
So if
Oh,
the-
really?
If the state ramps up their EOC in Framingham, we theoretically can communicate over the Webb EOC to them that we have a need, or we need more resources, or that there's one community that is in more dire trouble than others, and we can do that for them.
And it also spans through the New England states, because there's only one state in New England that doesn't use Webb EOC. And we all have the ability to be connected that way. So not only do you have 5 communities, a state, now you've got the whole New England region.
Theoretically, you could turn this over to a police task force, a fire task force, or an arson, or something like that. They could work all of their systems through the New England Regional Area Council, the DPH, the sheriff's office, anywhere, all through the internet. The systems are set. Someone would be sitting here monitoring the Webb EOC. And what that is really just every communication that goes out. If the shelter number 1 in Wakefield says we need more cots, it comes up on the screen. And then it's those people monitoring that put in, I have 30, I have 50, we can get you 10 here. And all that information comes together without phones ringing, people banging heads over it. They either say, you're approved to send, or not.
I guess on behalf of the legislators, let me just first say it's nice to be here. Hopefully you'll never have to use this center for you know, any major problem. But, you know, I think everybody recognizes that on the state level, you know, we're dealing with very tight budgets and a pretty, you know, difficult fiscal situation. This is exactly the type of thing that we're going to really expect and hope to see more of throughout the state. Communities getting together, regionalization taking place, you know, it's going to be very important. So hopefully this is going to be a great example, and we can build off of this onto other areas of municipal services to try to ensure that the communities make it through the crisis and that we're providing good services to all of our constituents. But we wanted to just make sure that we were here, obviously, to find out what you were doing here and how this center will work, but also to recognize Ben, who's done a great job in helping make sure that today that this whole project came together. And we have citations from the House and the Governor and the Senate.
I would just echo what the Senator said. This is a very impressive accomplishment. And I think it's a great example of collaboration among the communities regionally, and also collaboration between our communities and the state. So I want to extend our thanks and our congratulations to all the officials who worked so hard to make this happen. And there's one gentleman in particular who has just done an amazing job. We're so grateful to you, Ben, for your community service. You donated your time and labor and materials to help build this command facility, and also the new Board of Health offices, which are right here as well, which the town of Stoneham greatly appreciates. So from Representative Dwyer and I, this is from a citation from the Massachusetts House of Representatives. And I'll hand that to you. And 2 wasn't enough, so we thought maybe the governor would like to get in on the act. So this is actually from Governor Deval Patrick and Lieutenant Governor Timothy Murray as well. So we'd like to present that to you on behalf of the governor and the
Thank you very
Lieutenant
much.
Governor.